Good afternoon, everyone. This is the Joint Information Center briefing for January 27th, 2021. Have a look at our administrative notes here. Unified Command Team represented here on the call today. And then we'll hear from Mr. Alton during his time slot. Here are our priorities, our purpose, and then the agenda and the order of brief. I'll let you take a look at that and know when you are up. And we will begin with Eric from the Health Department.
Okay, thank you, and good afternoon, everybody. Just a couple quick updates. We're now up over 7,600 cases at 7,688. We have a total hospitalizations in Calhoun County between our two hospitals and elsewhere of 377. And unfortunately, we have reached another milestone, and we're at 201 COVID-related or COVID deaths. Most recently, as you can see on the graph, all the way to the right, you can see that our numbers are trending down. You know, they're not going straight down, but they are trending down. So that's good news, and we would like to see that continue and get us down even lower. Next slide. So I want to give everybody a vaccine update. It's been a lot of what we've been doing at the local public health and other, you know, the hospital systems and Grace Health here locally. So at this point in time, we're just finishing up vaccinating our 1A groups. There's still a few that are being scheduled by our partners out at Oaklawn and at Bronson Battle Creek. And then a few are still coming into the health department. I call them the stragglers, but they're just like a ones and twos from different organizations. So we are just about done with the 1A group, and we've moved into our 1B high priority group, which is our seniors 65 and older. And we have scheduled our schools for the month of February for first dose. And I think now all of our schools are scheduled or will be scheduled by the end of this week to get their first dose. We've currently, I'm at a vaccine clinic today. And this one today is going to be our largest mass clinic yet. I think we're scheduled to do just over 900 doses today of our seniors. So that's really good news. And we've been able to either already help hold mass vaccination clinics or scheduled to hold mass vaccination clinics in Battle Creek, Marshall, Albion, Teconcha, and Homer. We are also continuing to look for suitable venues throughout the county to try to do as good a job as possible of bringing the clinic to the people rather than the people come to the clinic. So far, and these numbers are as of last Friday, we've administered 3,016 first round doses just at the health department and 167 second round doses at the health department. And of course, at the state of Michigan has a dashboard that tracks just the total number of citizens in Calhoun County who have received a dose of vaccine, and that number is now at 8,700, and I think that's as of today. So that's anybody that lives in Calhoun that's received a dose of vaccine, not necessarily from the health department. And I believe this week we are scheduled for just over 1,900 more doses. So this time next week we'll have just over 5,000 first round administered. And I think with that, that is my update.
Thank you, Eric. Does anyone have any questions or anything they'd like to say to Eric? All right, hearing none, thank you, Eric, and we hope everything continues to go well at your vaccination site there today. Mr. Alton, if you are ready, please, sir, take it away.
Good afternoon. My name is Rod Alton. Can you hear me okay?
We can.
Very good. Appreciate the opportunity to provide an update in terms of some of the work being done in Eastern Calhoun County, in particular Albion. Albion, of course, was one of the 20 sites chosen by the Michigan Department of Health and Human Services to provide COVID-19 testing. And so we, the Albion Healthcare Alliance, has been involved with work there in support for the last several months. You can see some statistics provided here in terms of testing there at the site, in terms of not only the numbers of individuals who come in for testing from Albion, the number of positive cases, et cetera, but we're tracking a number of other types of data points as well, including from a race perspective, the number of non-white versus white residents coming in for testing. In addition to the testing, and again, the last bullet point just shows that from the volume perspective, our site has consistently been one of the in the top 3 or 4 test sites around the state in terms of volume and folks coming in for testing. While again, you can see the numbers coming in from Albion, we have quite a few people that come in from outside of Calhoun County, in particular Jackson, to get tested and so on. In addition to the testing, there are a number of things that the Albion Healthcare Alliance has also partnered with other provider organizations on to support. One of which is we provide one of our community navigators, a certified health worker who works on site 3 days a week at the testing at Washington Gardner, and provides navigation services for residents coming in for testing. So she's available, has a table set up there, and in terms of community information and referral services for people who need help in identifying and locating services, Vicky's available for folks coming in for testing on site there. Additionally, we partnered with funder organizations, in particular the Albion Homer United Way, to get PPE, in particular masks, to support residents who require masks, and we've kept them on site at the testing site there. As well as we worked with Albion Homer United Way to create signage both for Albion and Homer to make sure community residents knew about the testing site and had access to it. We partnered also with Henry Ford Allegiance for residents in Albion, in and around Albion, who needed support with transportation, just to ensure that transportation was not a barrier to them coming into the center. If we could have the next slide, or do I control that? There we go. This again is just some additional numbers as relates to the site. We've tracked, this is only for the last quarter, but we've been tracking data from the very beginning in terms of the numbers of folks coming in for tests by week. So you can see that in terms of total, the numbers per week, as well as the tracking it by county. So, and as you can see, by far, most people are coming in for testing who live in Calhoun County, with the second being Jackson and a few in adjacent counties. Next slide, please. Just a little bit more in terms of the work that we're doing. In addition to the testing site and providing support there, we've also been collaborating and partnering and trying to support the work of the County Health Department, Carewell, in particular around the helping folks get on the waiting list for the vaccination 65 plus age category. So our 2 navigators have been taking lots of calls. To date, they've taken in over 400 to 500 calls in the area just to get people on the waiting list for vaccination. So we're working very closely, not only in terms of taking the calls and working with public health to support this, but because of our network within Albion, we reach out to a number of key network folks who get the word out as well as it relates to vaccinations, when we learn more about where vaccination sites are going to be and so on. So we're continuing to really focus on partnering with local organizations to support the best ways we know to get people both on the testing side and on the vaccination side in Calhoun County. And that's all I have.
Thanks very much, Mr. Otten. Does anyone have any questions at all? Looks like there is something up here on chat. How long does it take to build up immunity after the second shot? Anyone care to answer that?
Yeah, I can. Right now, the indication from both Pfizer and Moderna is 14 days after the second dose. You would be fully effective on whatever their effective rating was.
Excellent. 14 days after the second dose. Thank you, Eric. Seeing nothing more on chat and hearing no other questions, we'll hand it over to Calhoun County Administrator Kelly Scott.
Thank you. Good afternoon. Hearing Rod Otten's voice reminded me that I used to see Rod almost every day at the Battle Creek Y, and I just have to tell you, he's one of the fastest on a spinning bike that I have ever seen in my life. And we go to different gyms now, but just memories like that, I think, are hopefully what keeps us all motivated to persevere through this vaccine process so that we can all get back to interactions like that. So my slide today is to talk about our vaccine scheduling process for those 65 and older. As Eric alluded to, our county is currently allocating more than 2/3 of our vaccine supply every week to vaccinating our seniors. And in this case, seniors has been defined by the state health department as those age 65 and over. I'll just note that there was no process or app or form developed and handed down to us by the federal or state government to assist states and to assist counties with deploying any consistent process for getting our residents vaccinated. We knew immediately that having mass clinics with long lines waiting outside in the snow was something that was not acceptable to us. I hope that just explaining in a little more detail what we have in place will help with the patients and the success rates that we've been having with our current process to get our seniors vaccinated. So if you go to the county's website and click on health and then click on COVID-19 vaccine information, you'll see this message. Calhoun County seniors, due to extremely high demand, all current Calhoun County clinics are full. Seniors age 65 and over are encouraged to call 269-441-0912 to be put on a waiting list. And on behalf of our Joint Operations Center Unified Command Team, I want to express how grateful I am to CareWell Services under the leadership of Carla Fales for taking the lead to manage our senior vaccine scheduling system. Carla and her team are assisted by the County Senior Services Office under the leadership of Helen Guzzo, and the Albion Health Alliance, as Rod just explained, is one of the things they've agreed to step up and help with, as well as our own health department staff, so that our community can count on up to about 15 individuals working daily to get our seniors scheduled in the most efficient way that we could come up with for the next weekly clinic that we have available. So our vaccine clinics, as Eric explained, are being scheduled for one or more each week, and that's based on the supply that we know that we will receive. So currently the supply has been just under 1,000 doses per week. I do, based on news you may have seen, I do want to assure the public that our residents are receiving as much of this supply as possible as we can get in. And definitely we would administer more doses if our allotment through the state and through the federal government was increased substantially. We look forward to having an increased supply to speed up the administration. So to this slide, how the Callin scheduling system works is basically a 3-step process. And the content of the slides really starts on the 3rd step. So the first step is just to call the scheduling number 269-441-0912 24/7, and you will get a recorded message. You will not get a live person answering that line. And that's because that's the most efficient way for us to simply capture phone numbers based on the time called and really just enter that information for a callback when we can have a more meaningful conversation. So our system records your information, and then based on the date that you called, you will get a recorded message called back within 2 to 3 days. And it is a recorded message, but it will just let you know that you should be assured that we have in fact placed you on a wait list, and then and that it tells you that you should just now be patient and you'll hear back again once we're ready to schedule your appointment. So after that initial call back, you don't need to do anything further. You don't need to respond to that. And just know that at this point, based on, again, the supply and the fact that we have about 7,000 seniors currently on the list, that it's going to be a few more weeks before you'll actually get that appointment. When we get to your name on the list, based on the time that you called, first come, first serve, the staff will call back and actually have a conversation with you to make that appointment. So as new clinics are being added every single week, those on the wait list are receiving those calls to make the appointment. So the list will go down. We're scheduling approximately 1,000 per week right now. That will increase, and obviously there are a finite number of seniors that live in Calhoun County. I think it's around 28,000. So eventually we will get through the list, and it will be accelerated. We ask that seniors answer the phone, even if it's an unknown number, which sometimes is a little bit scary. But because of the number of staff that are managing the system, calls are being made in the evening, and they're sometimes showing up as potential spam because you don't have their name and contact number in your phone. So generally, we will be calling you over the weekend or on Monday and Tuesday to schedule your appointment for the next week's clinic, because we need to make sure that we know what our weekly supply will be so that we can avoid having to cancel. So this time you get the call. It will not be a recording, but it will be a member of the team who will make sure that you have their name and a different phone number than the one that you called to schedule to communicate back and forth. If seniors are successful signing up for vaccines elsewhere, because we know there are different options right now, including Bronson. If you were on our waiting list and you end up being able to get a vaccine elsewhere, please call us back and let us know that at 269-441-0976 so that we can remove you from the list and let someone move up in the line. As I mentioned, right now, the list is about 7,000. I also want to mention that there are 2 scams that we have recently become aware of. The first one is that callers are calling seniors stating that there's no longer any vaccine supply in Calhoun County, but hey, we can offer you a vaccine for $50. Right now, there is no charge for COVID vaccines through our health department. And so if anyone offers to give you a vaccine and charge anything, it's not legitimate. So when you're answering any calls related to the vaccine, it's good to have the caller confirm that they are in fact with the county's health department. It's okay to hang up right away if there is a suspicious caller, and then to report those to the authorities. The second scam is that callers are stating that Muslims or any other groups of individuals may be denied vaccines because of that status, because of race, because of ethnicity, because of religion. And we want you to know that this is an inclusive service through Calhoun County's health department. We will not discriminate against anyone. Those calls are totally not legitimate and should be ignored. So finally, on behalf of our Joint Operations Center, I really want to thank our seniors for being patient and understanding as we continue to vaccinate thousands of our county residents each week. I want to, again, thank all of the volunteers, the health department, who are really spending 24/7 running these vaccine clinics right now. Shout out especially to County Commissioner Kathy Suvetti, who's volunteering today. And then I want to just emphasize that right now, Carla Fales and our team is reporting that the vaccine scheduling system, as well as the clinics, is actually working very well. And for the most part, everybody involved, the seniors and our staff, are having very pleasant experiences. This is just a time of hope. It's so awesome that we can experience everyone working together to get as many people as we can vaccinated, to see the light at the end of this pandemic tunnel. We do believe that the public health department is very much equipped to excel at vaccinating the public. That's very much one of the reasons for public health departments to exist. And we will continue to work with our partner hospitals. We really appreciate those, and any other providers that become available to help our goal of vaccinating at least 70% of county residents by this fall. So we do hope that you understand the limitations and the challenges we're working with. Mainly right now, the biggest challenge is the shortage of sufficient weekly shipments of vaccine. And I'm optimistic that that backlog will decrease, and we will start to see an increase in our vaccine supply. We will start to see more approved vaccine providers, and we will succeed at our goals and can look forward to life without the current very restrictive COVID precautions. So that concludes my slide for today. Thank you.
Thank you, Kelly. A lot of great information there. Anyone have any questions or comments for Kelly? Okay, hearing none and moving on, we'll go to Assistant City Manager of Battle Creek, Ted Deering with City Operations.
Thank you, and good afternoon, everyone. So I would say at the City of Battle Creek, we continue to closely monitor the number of cases that we're seeing in Calhoun County, along with the percent positive and the hospitalizations, and being mindful of where we are at as a county, and certainly out of an abundance of caution for both the public and our employees. Most city facilities will remain closed through February. We continue to encourage our customers to utilize the alternative methods that are available to do business with the City of Battle Creek. And of course, we remain available by phone through our new 311 information center. So don't hesitate to call. Don't hesitate to reach out if you have needs. And even when city facilities continue to be closed, we're doing the best that we can to service our customers. Now, there will be one exception for the month of February. We are going to reopen full blast on a limited basis beginning on February 1st. You know, our plan is to strictly adhere to the DHHS orders limiting capacity, for example, and the types of uses. And of course, we will mandate that users wear masks at all times when in the facility and maintain social distancing. So we are screening individuals as they enter the building. The hours right now are set at 7 a.m. to 8:30 p.m. on Monday through Friday, and 9 a.m. to 5 p.m. on Saturday and Sunday. And if you do come to participate, please bring your own water bottle. We are anxious to create some recreation opportunities for our community, but again, in compliance with state and local orders and in a safe fashion that ensures that we protect all of our customers. We are going to be optimistic about the spring and the summer. Thus, given the lead time that it takes to put programs together, we are doing some registration for our spring break camp for our youth individual baseball, youth spring soccer, adult softball, the Kid Venture summer camp, we're getting a lot of calls for folks interested in those programs. We'll handle registration, but obviously we will adjust as needed, depending on what is going on with the virus. So get out and recreate if you can, but let's do it in a safe way. And thank you, and that's our report for today.
Thanks very much, Ted. Great info there. Anybody have any questions for City of Battle Creek or Ted? All right, hearing none, we'll move on to the segment of the Joint Information Center briefing where we speak with and hear from our elected officials. We'll begin with Senator Bison, if you're on, sir.
Hi, it's Karen Todd from Senator Bison's office. A little different from the picture there. I guess from the state today, I just wanted to talk about a couple of things. First off, the Governor's State of the State address is tonight. It's at 7 p.m. It's virtual this year and can be viewed on a lot of different mediums. I think with TV8, probably Fox News, as well as online. So tune into that for information from the governor tonight. Also wanted to talk about some appointments that were made on Monday to the Bipartisan Protect Michigan Commission. It's been in the news a little bit, but I just wanted to briefly share with you. The focus of the Bipartisan Protect Michigan Commission is to help raise awareness of the safety and effectiveness of an approved COVID-19 vaccine, educate the people of the state, and help protect the health and safety of all Michigan residents. So I'm proud to say that Calhoun County is represented well on that commission. In being appointed were Mayor Mark Benke, Carla Fales, who I believe is on the line today, of Carewell Services, and Robin Burlingame of the Nottawasapi Huron Band of the Potawatomi in Calhoun County. We have some other constituents who made it on that list who are in other counties that Senator Bison represents. But we did get a notice this morning that that commission is going to be having some work groups all the way focusing from business leaders to seniors to youth, the rural community, African Americans, people with disabilities, veterans, the faith community. So if you know anyone who is interested in sitting on the work group for that commission, please advise them that they can apply to that. And if they want to contact Senator Bison's office for additional information on that, they're more than welcome to. And I think that's it. We're still fielding multiple unemployment phone calls per day, and we're getting some people's issues taken care of, but others are still slow moving. So if people are having issues, please encourage them to reach out to Senator Bison's office. We will try and help them as much as we can. And I think that's all that I have. Thank you.
Thank you, Karen. Does anyone have any questions for Karen through Senator Bison's office at all? Okay, moving on. Representative Haadsma, if you're on the line, please take it away.
This is Paul from Representative Haadsma's office. I know he's getting ready for session today at 1:30, so I don't think he was able to get on the call. I don't have anything to add beyond what Karen said. I'll put my contact information in chat, and if anybody needs something from Rep. Haadsma's office, please get in touch with me.
Thank you very much. Representative Hall. Hearing none, we'll open it up to county elected officials that are with us in attendance.
Hi, sorry.
Moving on to tribal officials.
Say hello. Yeah. Hi, this is Matea from Representative Hall's office. I'm sorry,
Excellent.
I'm sorry, I had my microphone on. Representative Hall's
Go right ahead.
Thank you. He is on his way to session. I wanted to provide a brief update because the House has released its plan or proposal on COVID-19 response. So this is a new plan that will need to be, worked on with the governor as well. But the plan basically highlights a few key areas in terms of COVID-19 response. So one is trying to help job providers and their families. So this would be a focus on proposed allocations of money to help restaurants, for example, small businesses that have been impacted by COVID-19, along with ensuring relief for local Michigan job providers and trying to assist in that area. Also, a big focus of the plan is the vaccine rollout. Closely monitoring how the rollout is going, along with putting money towards virus testing, for instance, which would be allocated quarterly. And there's a lot to this plan, but another emphasis area is on schools and trying to make sure there is funding support for teachers and staff as schools transition more back into in-person learning. So if anyone has questions, we can, be reached at our office. We're happy to, be available. And our office phone number, just for reference, is 517-373-1787.
Thank you very much, Mathia. We appreciate that. Does anyone have any questions, comments, or reactions for Representative Hall's office or what Mathia briefed us? Okay, I believe we left off. Is anyone from tribal officials on the phone with us? Moving next to city elected officials. Township elected officials. And wrapping it up, any village elected officials in attendance today? For the good of the group, we look at this slide, we see the best sources for information here. We have from Calhoun County, the City of Battle Creek, State of Michigan, and the CDC. Those are links up and available for everyone to check at their convenience. And then to finish it out, here are the different individuals that you can contact at their respective agencies, homes. We have Lucy with Calhoun County, Victor with Calhoun County, and of course Jessica with the City of Battle Creek. Are there any, as we wrap things up, any parting comments? Does anyone need to bring anything up that they have not already? Hearing none, thank you very much. Thank you all for joining us. Thank you for the information that passed through, and we'll be in touch in 2 weeks with the next live Joint Information Center briefing. Thank you very much. Have